Hi everyone, thank you for joining me in this presentation today. My name is Hayley Bowers. I'm an occupational therapist here at the Health Lodge, and I'm also trained in trauma-informed yoga and meditation and eye movement desensitization and reprocessing, also known as EMDR. And I'm here to talk to you today about how occupational therapy, or OT, can be a really beneficial service for our clients and patients that are living with chronic conditions and autoimmune conditions. Firstly, I would like to acknowledge the traditional owners of the land on which this presentation is being delivered, the Arakwal people of the Bundjalung Nation, and pay my respects to elders past, present, and emerging. So living with autoimmune conditions can present really unique challenges impacting most of our areas of life. Simple, everyday tasks become monumental, and it affects our independence, our social interactions with other people, our life roles, and just our overall quality of life. I landed in this space because I've been shaped by my own chronic health journey, and this has helped me to really understand the complexities and stresses that come with this kind of journey. And this lived experience just helps with informing my therapeutic approach with my clients in practice. And this also led me to become trained in EMDR and trauma-informed yoga and meditation, because I understand how important the role of the nervous system plays with people that have a chronic health picture. And I draw on these skills as a part of my approach. So if you're wondering what occupational therapy is, I'm just going to give a brief overview of OT if you haven't come across it before. So firstly, I'll start on the definition of occupation. So this is not to be confused with job or vocation. So in the context of occupational therapy, the term occupation has a broader and more specialized meaning than its common usage. In occupational therapy, an occupation refers to any meaningful and purposeful activity that individuals engage in a part of their daily lives. These can encompass a wide range of tasks, roles, and responsibilities that people need or want to do to take care of themselves, participate in their communities, and lead fulfilling lives. Now, I'll expand on this a little bit more in a future slide. So occupational therapy overall is a healthcare profession that focuses on helping people of all ages and abilities to participate in these daily activities and tasks or occupations that are meaningful to them. Occupational therapists work with individuals who may be experiencing functional challenges. Now, this could be any kind of functional challenges, but in this example, I write physical, cognitive, emotional, spiritual, that may make it difficult for them to perform their daily activities. So as an example, I've written up some of my occupations that I engage in on a daily basis. So we tend to break these down into self-care, productivity, and leisure. So self-care are the things that I need to do to meet my basic needs and are necessary for survival. Productivity is more of the things that we do to live productive lives, like working, volunteering, and our life roles. And leisure is more of the things that we like to do that brings us more joy and meaning, and maybe things that we would do to fill up our cup. So here I've written some of my self-care is obviously things like sleep and my oral hygiene, eating and drinking water, being able to attend necessary healthcare. Productivity, I've got driving to work, education, volunteering, and cooking and cleaning. And then in leisure, some of the things that fill up my cup are like yoga, beach walks, spending time with my family, dancing, going to restaurants and cafes, lots of different things on there. So those are things that kind of put me into a flow state where I lose track of time. And this is going to be different for everybody. Everybody has different occupations, and that's what makes occupational therapy such a unique profession, because when we see our clients, we're working on different things because it depends what's important for that person. So maybe have a think now of what your occupations might be. So, there's so many things that make up our occupations. How often are we doing it? Why are we even doing it? Is this something that we were raised with and that's why we've kind of continued this pattern, or is it something new that we've picked up? And does it cost money? Or what kind of equipment and resources do you need to do these occupations? For example, yoga classes can be quite expensive. Going to the beach is free, but do you live near a beach? There's so many different things that can impact someone from being able to engage in their daily occupations. So maybe take a moment, pause the video, and just have a think of your self-care, productivity, and leisure occupations, and just sit with that for a moment. Once you're done, come back, and so you can, I guess now you can see how everybody is really different, and one of my roles as an OT is to understand what occupations are important to the person so that I can understand what are their goals that they're wanting to work on. Not based on societal expectation. A person that is living with a chronic condition, their primary goal might be they want to return to golf. So that's what I'll focus on. It's really different for everyone. And that's what makes it quite a rewarding space when you're working on things that are really important for people. So living with chronic conditions can present with very unique challenges impacting most of our areas of life. So OTs can recognize the nature of these challenges, whether it's the frustration of being unable to perform our normal activities, or the cognitive fog that might cloud our decision making, or the emotional toll that might come with navigating a life-altering diagnosis. We are uniquely positioned to be able to address these issues. So by understanding the impact of the condition and how that impacts on someone's ability to manage their daily life and do their occupations, this is how we can tailor our interventions to help the individual gain a sense of control and work on building back their independence in different ways. So the way that I approach this in an integrative healthcare modality is I focus on lifestyle modifications. So I provide guidance on lifestyle interventions like exercise, nutrition, sleep hygiene, energy conservation techniques, time management, breathing, posture, and environmental factors that might be impacting our health. These can be quite small but very intentional and impactful adjustments in daily habits that can lead to significant improvements in overall well-being. I also work on mind-body interventions. So this is where my yoga teacher training and my training in EMDR plays a huge role in being able to support the nervous system through relaxation and breathing techniques, sensory modulation, so that people can improve their overall nervous system state and reduce the level of stress that might be playing a significant part in their chronic health picture. And a big one that you may already be aware of that a lot of OTs work with is environmental modifications. So this is where those are the two that I've just mentioned focuses more on adapting like the person and what they're engaging in, whereas this is more changing the environment. So modifying the home or work environment to be able to help them engage more independently in their occupations. So this might be through assistive technology, home modifications, equipment, ergonomic changes, lighting, and other factors to make tasks easier and more manageable in broken down steps to be able to improve overall independence. So individuals that live with an autoimmune condition and chronic conditions really differ person to person. So this is why having an OT on board in the team in an integrative healthcare model can really be valuable in supporting the client moving forward with their health journey and being able to tailor interventions that suit them individually. There's no one size fits all approach. So if you're still wondering whether OT could be beneficial to be involved in your health journey, some of these pointers might be able to assist. So if you're noticing that you or the client is having trouble being able to carry out their daily tasks and occupations, this is a big key sign as to a good way to get an OT involved. Another thing is they've withdrawn from their occupations because of their condition, and maybe they're having difficulty implementing their treatment plan because of some of their symptoms. So another health practitioner, like a naturopath, doctor, might be recommending interventions and they're noticing the client is having trouble with following it. An OT can come in this instance and recognize, okay, what's going on here? Is there something from a cognitive, physical, or emotional perspective that might be impacting them being able to move forward in building independence with these things and being able to follow a healthcare plan? This is where things can be very tailored approach to support them moving forward. So that's a brief overview of occupational therapy and our role with clients with chronic conditions and autoimmune conditions. As you can see, I'm quite passionate about this area because of my lived experience, and I understand that it's just not a one-size-fits-all approach. It needs to come from all angles, and I find that occupational therapists can be really integral in a team environment, as we can just look at the client picture from a lot of different angles. So if you are interested in knowing a little bit more about occupational therapy, or you're still unsure, or you would like to book in a session, please reach out to the Health Lodge today and get in touch with me. Thanks for your time listening, and I look forward to connecting with you.